Let's imagine that you are a patient in a hospital. Would you prefer your physician and care team to run a bunch of diagnostic tests until they found the answer? Or would you prefer if they sat down with you and talked with you, asked you questions, involved you in your care, and that they worked effectively and efficiently, only running diagnostic tests that were necessary? I think most of us could agree with the second option. Up until the turn of the 20th century, the quality of healthcare was never really monitored or truly considered a factor within the care delivery system. Physician salaries were based mostly on the volume of services that they performed rather than the quality of those services. Thanks to publications from the Institute of Medicine, such as To Err is Human in 2000 and Crossing the Quality Chasm in 2001, the way healthcare was delivered and the quality of care being provided began to see improvements. To Err is Human revealed the seriousness of these quality issues in healthcare, and Crossing the Quality Chasm provided a new structure, reformatting the delivery of care. This new structure provided six important aims for improvement, and they are as follows. Number one, safe. The patient's safety should always be held with the highest regard. Number two, timeliness. As stated on page 10 in the Healthcare Quality Book, means the degree to which individuals and groups are able to obtain needed services. Number three, the effectiveness of care. Number four, efficiency, how well resources are being utilized. Number five, equity. Every patient, no matter their race, ethnicity, socioeconomic status, or the like, be treated equally with the best outcome as the goal. And last but not least, patient centeredness, which involves encouraging the patient to participate in decisions regarding their care and providing them with the proper resources to do so. With these six aims in mind, the healthcare system began to see and implement a change from a fee for service model to a value based purchasing model. A value based purchasing model is where care providers are no longer refinanced by the volume of their services, but by the quality of the care that they provide. It requires medical facilities to use different tools, such as benchmarking or dashboards, to monitor different quality measures and collect relative data. Care providers also have to translate this relative data in a way that patients can better understand it to help them with making informed decisions about their health care. Value-based purchasing models are important because they aim to follow the IOM 6 quality measures and encourages physicians to improve their care delivery based on the patient experience, which is ultimately crucial for both parties involved. For healthcare providers as well as patients, implementing a successful value-based purchasing model can prove to be very effective and efficient and lead to care that is more patient-centered. Take, for example, one of the biggest accountable care organizations in the United States, the Advocate Medical Group that is located in Chicago, Illinois. In 2008, AMG wanted to increase the quality of their care, and one of their strategies was to begin introducing a pharmacist to the care team to help make the patient experience better and work on decreasing the number of patients being admitted to the hospital for heart failure complications, as well as readmission rates. This was their starting point. The pharmacist was trained to better understand heart failure as well as the medication management that goes along with this chronic illness. To monitor their improvements, they evaluated the number of patients admitted to the hospital due to heart failure as well as readmissions. AMG also used the healthcare effectiveness data and information set, as well as the Centers for Medicare and Medicaid Services STAR measure benchmarks to monitor quality improvement efforts. While executing their new healthcare plan, they identified a need for improvement in care for patients with other chronic illnesses as well, such as diabetes. So, not only was the pharmacist aiding in helping patients with heart failure maintain better health, but expanding the improvement and better aiding patients maintain their diabetes and other common chronic illnesses. For these pharmacists, seeing a large volume of patients can sometimes affect care, and AMG stated in their research that they are also observing how much a workload may affect outcomes for patients. In doing so, AMG is helping to provide better care for patients while including them in their care and working towards the best possible outcome. They are following the IOM's 6 aims at providing care. After only 10 months of implementing their new plan, AMG decreased the number of hospitalizations in half and saved approximately $280,000, and that was only in 10 months. AMG also went on to be recognized in 2012 as one of the top 5 out of 250 places for helping patients to manage diabetes in their area. They attribute their success to the capability maturity model, as well as the use of electronic medical records, which allow for easy access to all of the patient's medical information and made it easier for other individuals involved with the patient's care to share important information. The positive impact from value-based purchasing model is obvious. All care providers should want to provide excellent care to their patients. With value-based purchasing, physicians are not only financially motivated, but also intrinsically motivated by the fact that they are providing good quality care and working towards the best possible outcomes for their patients. This model works towards a future where healthcare is more cost-effective and of higher quality. However, some physicians do worry that value-based purchasing might not work well for all care providers. In his 2013 article, Will Value-Based Purchasing Increase Disparities in Care?, Andrew M. Ryan fears that some may be negatively impacted by this healthcare reform. Ryan states, lower performing providers tend to care for poor patients and have a larger share of patients from racial or ethnic minority groups than do higher performing providers. If these providers receive lower incentive payments or face payment penalties, they may be less able to fund quality improvement initiatives, an effect that could in turn increase race and income related disparities in care. For both current and future healthcare workers, it is important to recognize the faults and negative adverse effects within the healthcare delivery system and improve them. Healthcare organizations should monitor quality to guarantee care that is safe, timely, effective, efficient, equal, and patient-centered. By doing so, care providers can work together towards providing a better overall healthcare delivery system for the future.